Hello, welcome back to this audio number 17. This will probably be at least for the time being, it will be last audio on diabetes. After this, we will take a break for 1 week. People wanted some break to catch up and also because of Christmas vacation. And then we will start on the diet part. And when we finish the diet, then we will come back to diabetes, because then so far we have discussed what is diabetes, how our concept is different from accepted concept, and what are the causes and what are the etc. Now, so far we have not discussed about what to do about it. Of course, you are all intelligent people, so you must have got an idea that when you know the reasons, you can intuitively guess what the remedies are going to be. But exactly in what shape it will be, how it will be made, on what basis we will decide individualistic pattern for everybody, all that we will discuss when we finish the diet part. Yeah. Sometime in between, I don't know how to fit. I wanted to actually do obesity also and then start diet, but I think many people are waiting for diet. So let us, after this, of course, after this there will be one more audio to answer all the questions. I have received a lot of questions. I wanted to wait till we finish the discussion on diabetes so that all the questions related to this topic I will compile and make one audio to answer them. And then we will start diet. Yeah. So one topic which sort of I had not explicitly discussed was, why is diabetes so dangerous and harmful? Of course, we discuss from time to time concept of metabolic disease. We saw that all these diseases are connected. So when you get diabetes, then the risk for other diseases also increases. We also saw that the underlying mechanism, there are two things, chronic inflammation and insulin resistance. These are the two concepts which are fundamental to all the chronic diseases or all the metabolic diseases that we have considered. And therefore, in that sense, of course, we have seen that diabetes does increase the risk of other diseases. But now, let us talk a little bit for 2-3 minutes on very specific things. So nobody dies because of high sugar level or low sugar level. Unless the sugar level goes less than say 60, then of course that condition is called hypoglycemia, which is absolutely dangerous, much more dangerous than high level of sugar. But if your glucose level goes to say beyond 800, 900, then also you can go in coma. But very few people die because they go in coma either due to very high level or very low level of glucose. Mostly people die because of complications. Now, biggest reason actually why diabetes is dangerous is because ये जरा छुपा रुस्तुम है, वो hidden disease है. It goes undiagnosed in large number of cases, and when they discover because of some other reason, they have to undergo some operation, wound is not healing properly, quickly, whatever, and they are asked to do a test, then suddenly they find, oh, how come my sugar was 400, 500, like that, and then it's perhaps a little bit late. And I'm sure that 60, 70, maybe 80% of Indians have never done any laboratory test in their whole life. So how many of them are actually suffering from diabetes, we have no clue, Even in those who have got diagnosis and declared as diabetic, we are topping the world ranking now. We are going to become world capital of diabetes. But even more frightening thing is that there are so many people who have simply not checked any time, and so they may be suffering from this disease, don't know it, and then they may be dying because of some other complication. The growth rate is really, really, really scary. The rate at which it is growing. Look, 2 centuries back, this was not a major cause of, even minor cause of death, and now it is becoming third. And this causation also, many people, as I said, they don't die because their sugar is high low. They die because they then get cancer, they can get BP, then they get heart trouble or stroke and then die, and then that death is classified as a death due to heart disease or because of cancer or because of stroke, But many times, in half number of cases, the starting point is diabetes. So if you consider at least part of those deaths as the reason being diabetes, then the diabetes becomes a very, very important cause of fatality. Now, one more reason why this disease has become so dangerous is because of the refusal of medical fraternity to treat the root cause. See, we have seen the history, earlier even in the contagious diseases or diseases connected with unsanitized conditions or, there the cause was known and medical profession did take care of the cause and therefore they were successful. Now in these diseases, they are just treating basic symptoms. So you are never cured, and then one thing leads to another. You become more and more diabetic. For one medicine, then two medicines, then finally insulin injection, then that also doesn't work. It's a typical graph that diabetic patients carry. And the complete refusal of medical profession to even consider, even try to understand the science that this condition could be reversible. They just, it's become a dogma, it's like become like some scripture, some religious belief that, this is so and this is not negotiable. This is not something that I'm going to discuss. That is an attitude which simply is not allowed in science, Why science works is that challenging is always allowed and the challenge is not taken personally, but for whatever reasons, medical profession doesn't want to do that. Maybe there are vested interests involved. I don't want to comment on that because the reason is immaterial. The fact remains that the whole focus is on treating symptoms, which is now we have discussed for a long time that it is not a good way to tackle any disease and we don't want to go it that way. Now, as I said, we have already discussed the risk increase for metabolic diseases. Now, let us consider a few other diseases which we have not considered so far because they did not fall into lifestyle disease or they didn't fall in the umbrella of metabolic disease. So, the complications because of diabetes type 2, they are categorized two ways, macrovascular and microvascular. Macrovascular are the diseases that are caused in the bigger veins, where the size is bigger, so like arteries. And these arteries supply big amount of big blood supply to heart, all the organs and to brain. And if there is some block in that, we die because of stroke or heart disease, right? Like that. But then there are microvascular diseases. That means as this blood supply follows through different parts of the blood, part of the body, they become smaller and smaller in diameter. So finally they become what is called micro diameter, micro scale flow. And any problem in that causes another type of issues, and we have not discussed them. They are, say, retinopathy, which that means the supply to eyes becomes defective or insufficient, and then there are many eye complications, and it's called retinopathy. And finally, many people become blind in that. Now, please remember that in India, percent of blind people is highest. And do you think that they all are born blind? No, very few people are born blind. Some of them, of course, become blind because of accident or something like that. But mostly, these are the people who were never detected for diabetes and they became blind because it just went out of control. Then there's a neuropathy, where nerves become numb and they lose a sensation. So that is the reason why diabetic people don't feel the pain. Even in case of heart attack, which is heart attack is supposed to give you immense pain. It is one of the most unbearable pain. But heart attack in diabetic people is silent, so they don't even get a pain out of that. So they don't get any warning. Similarly, in tooth, etc., in the feet, etc., you don't get pain. So even it becomes infected and finally, your gangrene develops and you have to do amputation. Now, this amputation business and all, it must be, you must not be very familiar, because in educated class, normally things are not allowed to go to that extent or that level where amputation has to be done. But believe me, overall in India at least, number of amputation cases because of uncontrolled diabetes are very high. Then there is a nephropathy. I think this is the most neglected risk in case of diabetes. Once I had mentioned, you remember that so many people have to go on dialysis, and dialysis, this kidney failure doesn't occur in one day. It takes not weeks, months, years. So for years, the kidney is having problem, and that problem gets exaggerated, exacerbated because of diabetes. So nephropathy, which is a kidney failure, is again a big risk. Now, I have listed the how many times the risk increases, like myocardial infarction 2 times, 1.7 times. You can just have a look at the table and you will see that the renal failure, that kidney failure, is 3.5 times. That means your risk become 350% of what it is. 250% extra, man. You can, all these claims about these breakthrough medicines, you know what kind of improvement they offer? So statin says I will decrease the risk by 15% or 20%. And here we are talking about the risk going up by minimum of 100%, right? 1.2. 120% is the minimum, right? That is the total. So risk is 20, increase in risk is 20% minimum, and the maximum increase in risk is 250%. So this should give a wake-up call. Now let me try to summarize whatever we have learned. So before actually we started the diabetic topic, one very important principle that we learned was that the evolutionary adaptations of our responses to threats, two of them, stress and inflammation, they have gone out of hand, and because of our lifestyle, these two responses, which were God-given, they were like vardhan, gift of nature to fight the threat in the acute form. But we learned that we have mostly experiencing these responses in a chronic form, and chronic stress and chronic inflammation are the biggest threats, and they are the foundation of all these modern lifestyle diseases. That's what we had learned before we started on diabetes. Then when we started discussion on diabetes, the first thing I did was to redefine diabetes. Instead of defining it in terms of symptoms, that it is a disease where your glucose level goes up, I defined it in terms of the cause, which is insulin resistance, or the cause is that the glucose that does not get good easy entry into the cell. And I hope you like that definition. I like it very much because it changes our focus. It changes our focus from looking at glucose to looking at the problem of glucose entry. And when we ask why is the entry difficult, then we understand there is a problem with the insulin, and then we focus on the insulin. So that's why I like the definition. I hope you have liked it, and you will always consider diabetes in terms of insulin problem. And then we also saw that there are two types. One is where insulin is not produced at all, or it is not produced in sufficient quantity, and we call it diabetes type 1. And when it is produced, in fact, not in enough quantity, more than enough quantity, excess quantity than required in a healthy person. Even then, the glucose is not able to push the glucose in because of the phenomenon that we call insulin resistance. So this is the what we learned for that. And I try to show that this focus on symptoms is not a correct type of response, and we should try to focus on treatment of the root cause. We also saw that as a preventive measure, measuring insulin in your blood level whenever you measure glucose is an excellent preventive measure, because it gives us 15 years warning. It tells us 15 years beforehand that look, your glucose metabolism is not working properly. It is going away. Is becoming inefficient. You are producing more and more insulin to take care of the same amount of glucose, and that is putting a lot of extra pressure on your beta cells. So please don't do that. This message is so important. If just imagine if all of us, when you leave school or when you enter college, if this test of insulin is made compulsory, and I'm 100% sure that at that time most people will have insulin level around 5, and then if you check it after every 5 years, the moment it becomes 8, you will become very careful because you will know that your risk is now running high. And if people start taking corrective action at that stage, I think 70, 80, 90% of the diabetic cases could be avoided. So this is a disease, it's an invited guest, So I really feel so strongly about this test being included in all the panels. If there is one test, in fact, that I'm allowed to do, it would be insulin test. I have no doubt about it. Yeah. Then we also saw why insulin is such an important and dominant and powerful hormone. Now, don't take this in a wrong way. I'm not saying that other hormones are not important. All of them are. And in fact, power-wise also, I think thyroid hormone and cortisol hormone are even more powerful than insulin, and they can overrule insulin in some of the areas. Like if your thyroid hormone is not working well, there is no way you can drop it. You are going to become obese, because it simply keeps on converting all the fuel that you give into fat. That's all it does. So, but I am concentrating on focusing on insulin because that is the most prevalent one. See, about thyroid is important, no doubt, but it doesn't go wrong so much, at least not yet. I think afterwards, if we keep on with this lifestyle, I don't know what is going to happen after 2 generations or 3 generations. Right now, at least, it is not that important, and it doesn't become out of control in so many people. Another thing is, it is tested regularly. Unlike insulin, which is not tested at all, people do check their thyroid level, and if something is gone wrong, again, there also it's an autoimmune disease, and hardly doctor tells people that this is autoimmune disease. And we have seen that autoimmune disease, again, something is because of we did so many wrong things, probably because your gut lining got compromised. So, but once it happens, it happens. If your thyroid are damaged completely, then probably you have to take medicine. But the point is, it is kept in check, whether by medicine or by whatever it is. And therefore, not many people have a health problem because of thyroid problem. And that's why I'm focusing on insulin so much in this course. Doesn't mean that is the only thing that is important. Everything is important. Then, of course, we studied insulin resistance, and we studied what is the mechanism by which insulin promotes entry of glucose, and we saw how complicated it is, and we saw it's not as simple as just insulin sitting on the receptor. It needs a lot more things to happen inside the cells, and the cells have ability to either upregulate or downregulate those reactions. The chemistry, I think, was not meant to be understood by everybody, but at least I think that I hope that you people enjoyed seeing how complex the mechanism is. And this is the simplest thing that you can get in body. Thousands of chemical reactions happen which are very complicated, and entry of glucose is one of the simplest things that you can have. Even that becomes so complicated, involving so many things. So I hope you develop a little bit more respect about how your body works. Then we also saw the reasons, various mechanisms, and there are 7-8 ways that 7-8 things that can go wrong and can lead to insulin resistance. But luckily, unluckily, whatever, but it so happens that our diet habits is the maximum contributor. Lack of sleep is there, genetic reasons are there, lack of exercise is there, so many reasons are there. Fatty liver is there. But if you take statistics, then the contribution of wrong diet is the maximum, and that is one is the one which is manageable and changeable, So if it is genetic, you can't do anything about it, right? But look at it this way. In last 100,000 years, we have gone practically from 0% deaths to 10% deaths due to diabetes, and genes have not changed. So all these extra deaths that are occurring are not because of genes. They are because of the bad habits, bad food habits, bad lifestyle, which is giving an epigenetic type of signal for these wrong genes to get active and expressed, and then we are having a problem. So no doubt that this whole process is quite complicated. In fact, most experts from whom I have learned, and these are surgeons and doctors and very high-level scientists and who have spent their life in studying insulin resistance, they also say that we have also not fully understood. Part of the reason is every organ acts differently. That means if your muscles are resistant to insulin, doesn't mean that your liver is also resistant or your adipose tissue is also. Every organ has a different way of reacting to insulin and different level to which it can become resistant. Mainly we have considered mainly the muscles, because that is where the glucose entry is important, and that is where the maximum amount of glucose is absorbed and used for energy, and that is the reason why diabetes gets developed. So we are focused on that. Now surely people who want to know the very deep chemistry about it, I can surely give the links to these, but these are highly biochemistry oriented talks. So let me know if enough people are interested. I will dig up and give the links. So although we are going to focus on diet change in this course, I don't want you to neglect other aspects, the most notably stress, because I think taking care of stress is even more important than taking care of diet. Why I don't focus on it is just people don't make the change. I mean, not that they don't know that stress is harmful, right? They know that. But to fight it, as I have said again and again, you have to understand how our brain functions, how our limbic brain works, because it's all in the limbic brain. The whole problem is in the limbic brain. It's in the way it has got programmed, through evolution. So separate aspect, but surely after we finish up with CVD, I would, if there are enough people interested, I would definitely like to do a session on stress. Then number of times I mentioned about sleep, so maybe we will do one session on sleep. But these are the things that they are important. Whereas in diabetes and CVD, I am sure you will find, even in diet, you will find number of things that you were not aware of. So that is the power. That is something I want to transfer to you on more priority basis. So then we talked about the tests. And since in India at least many people don't get tests, we had one session on listing out early symptoms. And of course, I warned you that it's not that you will have all those symptoms, but if you have many of them, it's a good warning to at least go and get tested. Then we spent quite a lot of time on laboratory tests, and I tried to show you the limitations of the existing tests. And there seems to be still some confusion. So because one of my good friends asked me, okay, so you have now, what you have told us is none of these tests are really good. All of them are drawbacks. So finally, what should we do? So let me just add that answer here itself. See, the idea is that what you should do depends on your levels and what is your goal. So that's why I stopped at not giving recommendation on that. So it is like this, that once you understand the limitations, so you know that fasting insulin is not reliable because it is not the minimum value. Also depends on what you ate earlier. More so in case of postprandial, because what you ate 2 hours back absolutely matters for that level. So it is not comparable between two people, one who is completely vegetarian and one who is non-vegetarian. Their values postprandial are not comparable. For you also, what reading you had 1 month back is not comparable to what you had today. But if you understand these limitations, then you can sort of calibrate these tests with HbA1c and with GTC, OGT actually. So you know that in OGT you get this kind of profile, and in these tests you get this kind of profile. So you can calibrate them, and then you can interpret them accordingly. So that is one way of doing. The precaution that you must take is that you must decide your normal diet, whatever you normally eat. And whenever you want to do the test, the day before, you make sure that you stick to that normal diet as much as possible. Don't eat different things, don't eat them in different quantity. Try to have a same kind of food and same level of same quantity of food, same same exercise, etc. Routine on that day, and then do the test, so that test may not be comparable to somebody else's result, but for your own results, now they become comparable to what you had 2 months back or 2 years back, because you have kept the situation more or less the same. Yeah? That is one thing. Another thing you have to take into consideration is that if your levels are absolutely good or absolutely bad, then it doesn't matter. You don't have to go to the lab. Just the glucometer at home is sufficient, because error of 5-10 units is not going to matter. The usefulness of fasting test that I perhaps forgotten to mention is that if you consistently get fasting level higher than postprandial level, doesn't happen normally, but it does happen in many people's case, especially diabetic people. So that gives you a warning that this complementary nature of glucagon and insulin has broken down. So what is happening is that cortisol plus glucagon are breaking this glycogen in the morning in quantity far more than needed to prepare you for your day. So if somebody normally the level will go up by 10 units, in people where this relationship is broken down, it may increase by 30 units. So that's why your it's called dawn effect. So that's why your morning fasting glucose may be even more than BP level. Yeah. So GTT is something that you must do at least once, and maybe after every 5 years or 10 years. And how is to be interpreted is, if your fasting and postprandial are good, that means within range, but that means your fasting is around 100, your postprandial is around 130, but your 1 and 2 hour GTT test, which should be below 180 and 140, if that is at 300 after 1 hour, then what you know is your mechanism has all gone wrong. Now that is not getting reflected in your normal test, because you are not overloading the glucose. So if it is 300, doesn't mean you have to start medicine, because in normal days it is not going to that level, simply because you are not challenging your body with that kind of glucose level. So that test is not again mean for deciding whether you should to take medicine. Whether you should take medicine depends on so many factors. As I said, that none of these tests are enough on their own, and there is a matter of judgment involved. That is why the expertise of doctor is so important. It's a tragedy. It's a tragedy that we have to learn all these intricacies of diseases. It's a doctor who should learn that, and with his experience, we should leave it to him. That is the ideal condition, right? Now, whether we have a cancer or not, we don't try to study. We leave it to the doctor's judgment, right? Whether you have some contagion, whether you have a corona, we don't try to judge ourselves. We leave it to experts, and that's how it should be. It's only because of refusal of medical practitioners to focus on root cause that in these lifestyle diseases, we have to take the decision out of their hand and make the decision ourselves. And at least learn what these tests are, etc. So that was the purpose for going into the details of the test. When I talk again and again about medical fraternity, please understand I am not criticizing them. They are following what they are taught. So, and this is not a blame apportioning game. Even if they are to be blamed, we are responsible for our health. So just you must be wondering, so will it not change? If the science is so clear, will things not change? Of course they will change. But medical profession is one of the professions where the change is slowest. Even in science, it takes a long time for the concepts to become acceptable. You know how much time it took for evolutionary theory to be accepted? Even now, in country like US, there is such a opposition to theory of evolution. And the reason is not scientific. I mean, they don't try to challenge that, okay, this is the Darwin's experiment and we find this is the fault in that, or we find that this logical reasoning is not correct. It is not accepted because how can we have evolved from monkeys, It's so demeaning. It hurts them so much, So these are the reasons, and then there is no argument, it becomes dogma. So this diabetes is a progressive disease and cannot be reversed, has become a dogma, and once something becomes a dogma is not allowed to be challenged also. But does it mean it will remain like that? No, it will not remain like that. Finally, truth prevails. You remember that I give you an example of this Semmelweis, Hungarian physician. I wonder how many of you Googled that. I had urged you to see how science works. In the end, it truth prevails. So, if you have not heard, it will take only 2 minutes to tell you in short. So, let me go into that. So, the Semmelweis, he was a physician and he was working in hospitals, basically in child delivery, etc. And what he observed was the death rate due to what is called childbed fever, So the mortality rate was very high. And of course, mortality rate was high at that time for childbirth. What he observed was the mothers who gave birth to children at home, using these nurses and maids, there the birth rate was much less. Or there were some of the smaller hospitals where the birth rate, death rate was much less. So he tried to figure out why so. And then sheer out of his genius, he could not find any reason why doctors, reputed doctors, when they are doing this process, that death rate is more. So he simply said, okay, they're doing something wrong, right? So that time, but remember, this is in 1847. So that time germ theory was not known. Louis Pasteur had not discovered the germs. So it was not possible to understand why it happens. But he just hypothesized that maybe they are picking up something from one patient and getting transferred to another patient. He didn't know what, but he suggested a protocol that between two treatments of two patients, the doctor must wash his hands with chlorinated water, with antiseptic washing hands. And he insisted on that, and he started that practice in his hospital. And you know what? The mortality rate dropped like a magic. And don't you think that he should have convinced everybody to follow that practice? Because, of course, the reason was not known. He was not able to explain why it happens. Actually, that time the doctors were not specialized doctors for birth this and for this is that. They were handling all kinds of patients, and they were even doing postmortem. So they used to do postmortem. Then just come and without washing the hands, they would try to deliver a child. Now, we know what implication this has, but how would they know? When the germ theory was not known, how would they know? But this man, simply he thought that let us do it this way, and it works so beautifully. I think, there was Nobel Prize that time, but if there was, he should have been given that, isn't it? He was responsible for bringing down mortality for so much. But then what happened? You know what happened? No other hospital followed that practice because the doctor refused to believe, refused to accept that they are the carriers or cause of higher mortality. It hurt their ego so much that they simply did not look at the statistics. Not only that, his own hospital. And finally, this man was became, people didn't want to touch him, and he became a mental patient, and he died in a mental hospital. That is a tragedy, see, because he got so frustrated. I don't know whether he became mental because of this treatment that he got from the society or because of some other reason. That is not known. But he died in a psychiatric ward. And in his lifetime, that it was never recognized, because after a few years, when Louis Pasteur discovered this, then people realized what must be happening is these doctors were picking up the germs from one patient, and without washing hands, they were just giving those germs to the mothers. Yeah, but it took 50 years, 100 years for that to become a standard practice. But now even a child knows, right? And the corona has made sure that even a small child knows that best thing to protect yourself is wash hands. So anyway, so there is a hope, but we don't want to wait for those 50 years, right? We want to take care of our health today, right now. So therefore, let us not wait for the medical practice to change. Let us take care of our health. Now, I had tried my best to convince you about this insulin resistance and the need to attack the root cause, etc. I hope that all of you, if not most of you, if not all of you, have got convinced. If you are still not convinced, please tell me, debate with me, question me. What part don't you agree? I can give you more science. There is a lot of science available. I have tried to make it a simple and something that can convince most people. If you are not convinced, challenge me. Or best is you do research on your own. You have got enough background. You go back to chemistry books. You will understand. You go back to papers. I can give many links of doctors. Now, one lingering doubt, all the time that I face is that, oh, who are you? You are an engineer. Oh, well, actually, my understanding and my study of this field is as good as, anybody in this part, preventive part, not about medical part, medicine part, yeah, or about surgery or anything, naturally. But although I feel confident that I understand the chemistry very well, you may not trust. So you, therefore, if you want, in this the companion file that I made, I have given links to 3 or 4 people who are doctors, and actually I can give you examples of hundreds of doctors who were practicing traditional medicine, traditional way of curing. They got frustrated 2 ways. Many people about cholesterol, they got frustrated because their cholesterol was not going down, their risk was not going down. There were doctors whose own diabetic was not getting cured. So they studied, they understood the science, and they got so much convinced that they left their practice, and now they are practicing on the basis of this science. There are many examples of like that. So I can give you as many links. I can give links for sufficient material that will last you hours and hours. I have spent hundreds of hours in looking at both angles. See, when I started, I had no bias, right? Because I wanted to solve my problem. So I had no interest in proving it either way, that doctors are wrong or right. I was a problem which doctors were not able to solve, and I wanted to solve it. That's why I did all this research, and I'm trying to spread it because it proved so useful to me, and it is being shown as useful to most people who try it. But I have given some links, so go through those links. I can give you even more links. If you're not convinced, then don't just keep quiet. Come out with your objections. What is it that you don't agree? Healthy debate is always good, but make up your mind, because now unless you are convinced that we must attack the root cause, and this is insulin resistance and inflammation is a root cause, unless you are convinced about these things, it will be wasting time, because all our remedies are based on that, right? And the stakes are very high. Every year, from my batch, we are losing people who are departing. And in many cases, I feel the death was not necessary. If they knew, if they had taken proper care of their diet and their lifestyle, it was not necessary to die at the age of 70, 75. Yeah? So, well, you know, health is the most important thing, at least at our age. At my age, health is the, not most, it is the only important thing, right? If it is not good, we are not there. So, take care. Please believe in science. Trust science. Okay? Thanks. All the best. Let me stop at this. Bye.